Hi there, I'm a Psych NP and I have 15 test questions for you on the psychiatric drug Clozapine. Ready? Let's learn psych fast. Question 1. What is the primary characteristic of Clozapine's efficacy in treating schizophrenia? Is it A, reducing hallucinations, B, improving cognitive function, C, decrease in risk for suicide, D, alleviating aggression and violence? Answer: the correct answer is C, decreasing the risk for suicide. Now why? Well, Clozapine stands out among the antipsychotic medications because it's the only documented one to reduce the risk of suicide in individuals with schizophrenia. This feature is not just beneficial, it's crucial, considering that suicide risk is significantly elevated in this population. Now let's examine why the others don't hit the mark. A, reducing the hallucination. Well, Clozapine does indeed alleviate various symptoms of psychosis, including hallucinations. It's not the primary distinguishing feature. Option B, improving cognitive function. While Clozapine can lead to improvements in cognitive function, this isn't its standout characteristic in the context of treating schizophrenia. And option D, alleviating aggression and violence. While the medication does indeed have a niche in treating aggression and violence in psychotic patients, it's not its primary characteristic that sets that drug apart. Question 2. What distinguishes Clozapine from other antipsychotic drugs in terms of its mechanism of action? A, it primarily acts on D2 receptors. B, it is known to enhance cognitive function. C, it occupies fewer D2 receptors at the therapeutic dose. Or D, it induces awakening in patients with psychosis. The answer is C, it occupies fewer D2 receptors at a therapeutic dose. So Clozapine's mechanism of action is distinct from many other antipsychotic drugs in that it occupies fewer D2 receptors at the therapeutic dose. This is significant because traditionally antipsychotics primarily work by blocking dopamine D2 receptors in the brain. However, Clozapine's efficacy is not solely relying on D2 receptor blockade. Now let's look at the incorrect options. Option A, it primarily acts on D2 receptors. That's incorrect. Clozapine's efficacy is unlikely to be solely due to D2 antagonism. Option B, it is known to enhance cognitive function. While Clozapine may indeed improve cognitive function in some patients, this is not the primary distinguishing feature in terms of mechanism of action. Then option D, it induces awakenings in patients with psychosis. Well, the occurrence of awakening in some patients treated with Clozapine, that does happen. This is not, however, directly linked to the mechanism of action regarding D2 receptor occupancy. Question 3. How is awakening described in the context of Clozapine treatment? A, a return to near normal level of cognitive, interpersonal, and vocational functioning. B, a complete elimination of all psychotic symptoms. C, a sudden increase in aggression and violence. Or D, a temporary loss of cognitive abilities. The answer is A, a return to near normal level of cognitive, interpersonal, and vocational functioning. In regards to awakening, this refers to a significant improvement in various aspects of function beyond just alleviating positive symptoms of psychosis. Specifically, it entails a return to near normal level of cognitive, interpersonal, and vocational functioning. This suggests that individuals experiencing an awakening may regain abilities and skills that were impaired by their psychotic symptoms, allowing them to function more effectively in daily life. So let's go over the other options and why they were incorrect. Option B, a complete elimination of all psychotic symptoms. While Clozapine can indeed lead to improvement in psychotic symptoms, including hallucinations and delusions, the concept of awakening goes beyond symptom reduction to encompass a broader aspect of functioning. And then option C, a sudden increase in aggression and violence. That's wrong. Clozapine may have a niche in treating aggression and violence in psychotic patients, but does not suggest that an awakening involves an an increase in these behaviors. And then option D, a temporary loss of cognitive abilities. Again, this is not correct because it goes against the concept of awakening, which implies a positive outcome involving an improvement in cognitive function rather than a temporary decline. Question 4. In terms of side effects, what is one of the positive aspects of clozapine? A. It causes motor symptoms. B. It may cause tardive dyskinesia. C. It effectively treats tardive dyskinesia. Or D. It elevates prolactin. The correct answer is C. Clozapine causes little in the way of motor symptoms, does not seem to cause tardive dyskinesia, and may even be effective in treating tardive dyskinesia. This indicates a positive aspect of clozapine as it not only alleviates the symptoms of schizophrenia, but also potentially addresses tardive dyskinesia, a side effect commonly associated with long-term antipsychotic use. And option A is incorrect. It causes motor symptoms. No. Clozapine causes little in the way of motor symptoms, which is a positive aspect. And then option B, it may cause tardive dyskinesia. No. Clozapine does not cause it. So, of course, that's wrong. And then option D, it elevates prolactin. It does not do that. In contrast to many other antipsychotic medications that are known to elevate prolactin levels. Question 5. What is the significance of managing side effects effectively in clozapine treatment? Is it A, to prevent motor symptoms, B, to avoid tardive dyskinesia, C, to reduce the risk of neutropenia, or D, to elevate prolactin levels? The correct answer is option C, because it aligns with the specific concerns regarding one of the unique side effects of clozapine treatment, which is neutropenia. Neutropenia is described as a life-threatening and occasionally fatal complication of clozapine treatment, emphasizing the importance of managing side effects effectively to mitigate this risk. Therefore, monitoring blood counts and promptly addressing any signs of neutropenia are an essential aspect of managing clozapine treatment. Option A, to prevent motor symptoms, that's incorrect, because motor symptoms are not a significant concern or side effect of clozapine treatment. In fact, clozapine is known to cause little in the way of motor symptoms. And option B, to avoid tardive dyskinesia, that's wrong as well. Clozapine does not cause it at all, and actually may even effectively treat it. And then option D, as we said in the previous question, to elevate prolactin levels, that's wrong because clozapine does not elevate prolactin levels, rather it decreases it. Question 6. Which treatment option is suggested for mitigating excessive salivation caused by clozapine? Is it A, antidepressant medication, B, botulinum toxin injection, C, antihistamine drugs, or D, anti-inflammatory drugs? The correct answer is B, botulinum toxin injections. They are suggested for mitigating excessive salivation, which is caused by clozapine profound muscarinic blockade, especially at higher doses. When clozapine leads to excessive salivation, particularly in severe cases, localized botulinum toxin injections can be effective to address this issue effectively. Now, option A is incorrect. Antidepressants. Antidepressants are not typically indicated for the management of excessive salivation caused by clozapine. While antidepressants may have other therapy uses, it's not used specifically in this way as the question presented. Option C, antihistamine, is incorrect because antihistamines are not mentioned at all in the treatment of clozapine. They're commonly used for allergies or motion sickness, but not for the side effect of excessive salivation induced by the medication. And option D, anti-inflammatory drugs, will not address the excessive salivation induced by the drug. Question 7. Which statement accurately describes the weight gain associated with clozapine use? Is it A, it is minimal compared to other antipsychotics? B, it is not associated with weight gain? C, it is moderate compared to other antipsychotics? Or D, it is associated with the greatest degree of weight gain? The answer is option D. It's associated with the greatest degree of weight gain. Clozapine is associated with the greatest degree of weight gain among the drugs for psychosis. Question 8. What is one of the distinguishing characteristics of clozapine among atypical antipsychotics? A. Lower risk of side effects. B. Moderate efficacy. C. Least sedating. Or D. Most side effects. The answer is D. Most side effects is correct. This statement accurately reflects one of the distinguishing characteristics of clozapine among atypical antipsychotics. While clozapine may have the greatest efficacy among atypical antipsychotics, it also has the most side effects. This implies that clozapine is associated with a higher incidence and severity of side effects compared to the other atypical antipsychotics. Question 9. What can exacerbate the risk of bowel obstruction when clozapine is administered concomitantly? Is it A. Benzodiazepines, B. Antidepressants, C. Anticholinergic agents, or D. Beta blockers? The answer is C. Anticholinergics. Because they can cause severe constipation, which is caused by the muscarinic blockade, such as that can be induced by clozapine. It can potentially lead to bowel obstructions, especially when it's administered with anticholinergic agents like benzotropine or drugs for psychosis with potent anticholinergic properties like chlorpromazine. Anticholinergic agents work by blocking the action of acetylcholine, leading to decreased gastrointestinal motility, which can exacerbate constipation and increase the risk of bowel obstruction. A. Benzodiazepine is incorrect because they do not have any anticholinergic properties and are not typically associated with exacerbating constipation or increasing the risk of bowel obstruction. Instead, benzodiazepines primarily exert their effects on the central nervous system by enhancing the activity of GABA receptors. Option B is incorrect. Antidepressants. While some antidepressants may have anticholinergic effects, not all antidepressants fall into this category. And then option D, beta blockers, that's incorrect as well because they do not have an anticholinergic property and are not typically associated with the exacerbation of constipation or increasing the risk of bowel obstructions. What do beta blockers do? They primarily exert their effects by blocking beta adrenergic receptors, leading to decreased heart rate and blood pressure. Question 10. Why is the use of clozapine low in clinical practice? Is it A, due to its high cost, B, because it causes minimal side effects, C, because of logistical barriers and side effects, or D, because it's not effective in treating psychosis? The answer is option C, because logistical barriers and side effects is the correct answer, as accurately reflects the reason for the low use of clozapine in clinical practice. The barriers are that it's a hassle arranging the blood counts, which are required for monitoring potential side effects such as neutropenia. Plus, there's those side effects as excessive salivation and constipation, which also might contribute to its underutilization. Option A, due to its high cost, that's incorrect because it's an old generic drug. It might be a little bit costly, but it's not expensive in comparison to many other meds. Option B, because it causes minimal side effects, that's incorrect. Because it's the opposite. There's a lot of side effects. They include excessive salivation, constipation, potential for neutropenia. Option D, because it's not effective in treating psychosis, not at all. Clozapine is described as a powerful therapeutic intervention for many patients with inadequate response for other drugs for their psychosis. Besides treatment-resistant schizophrenia, what is another indication for using clozapine? Is it A, for bipolar disorder, B, generalized anxiety disorder, C, severe tardive dyskinesia, or D, panic disorders? We said this one before, so I hope you got it. Option C, severe tardive dyskinesia, because it completely aligns with one of the alternative indications for use of clozapine. Tardive dyskinesia, refers to the involuntary movement typically involving the face, tongue, and limbs that can occur as a side effect of long-term antipsychotic use. Clozapine may be appropriate for individuals with severe tardive dyskinesia, as it can sometimes be reversed with high doses of clozapine. Therefore, severe tardive dyskinesia is identified as another indication for clozapine use, apart from treatment-resistant schizophrenia. Question 12. How is the effectiveness of clozapine sometimes increased? A, by reducing its dosage. B, by combining it with benzodiazepines. C, by augmentation with risperidone. Or D, by switching to another antipsychotic. The correct answer is C, by augmentation with risperidone. The effectiveness of clozapine may be increased by augmentation with risperidone. Augmentation refers to the strategy of adding another medication to enhance the therapeutic effects of the primary treatment. In this case, adding risperidone to clozapine has been reported to raise clozapine's concentrations and sometimes results in dramatic clinical improvement, thus increasing its effectiveness. Option A, by reducing its dosage, is wrong. Actually, reducing the dosage may lead to decrease in efficacy, especially in patients who have responded well to higher doses. Option B, by combining it with a benzodiazepine, is incorrect. While benzos may have an adjunct role in managing certain symptoms, they are not specifically involved in enhancing clozapine's efficacy. And then option D, also incorrect, by switching to another antipsychotic. Not at all. Augmentation with risperidone is a strategy for increasing the effectiveness of clozapine rather than switching to another antipsychotic. Switching to another antipsychotic would actually involve discontinuing clozapine, which would go against what we're trying to achieve. Question 13. How long does it typically take to reach steady state with clozapine administered twice daily? A, less than an hour. B, less than a day. C, less than a week. Or D, less than a month. Option C is correct, less than a week. If clozapine is administered twice daily, steady state would be achieved in less than a week. Steady state refers to the point at which the concentration of drug in the bloodstream remains consistent over time, indicating that the rate of drug intake equals the rate of drug elimination. In the case of clozapine, steady state is typically reached within a week when the dose is twice a day. Now, clozapine's peak plasma levels are reached at 2 hours, and of course, peak plasma levels refer to the highest concentration of a drug in the bloodstream after administration. Question 14. How often are weekly WBC count draws recommended during the first 6 months of clozapine treatment? Is it A, every day, B, every 2 weeks, C, every month, or D, weekly? The answer is D, weekly, because it completely aligns with the recommended frequency of monitoring white blood cell count during the first 6 months of clozapine treatment. Weekly WBC counts during the initial period is to monitor for development of agranulocytosis, a potentially life-threatening adverse effect associated with clozapine. By conducting weekly WBC counts, healthcare providers can promptly detect any abnormalities and intervene accordingly to prevent serious complications. Leukopenia, granulocytopenia, agranulocytosis, and fever occur in about 1% of patients. During the first year of treatment, there is a 0.73% risk of clozapine-induced agranulocytosis. The risk during the second year of treatment is less at 0.07%. For neutropenia, the risk is 2.32% and 0.69% respectively during the first and second years of treatment. The only contraindication to use of clozapine are a WBC count that falls below 3,500 cells, or a history of bone marrow disorder, or a history of agranulocytosis during clozapine treatment, or the use of another drug that is known to suppress the marrow, such as carbamazepine. Question 15. How should clozapine treatment be managed if a patient is diagnosed with myocarditis or cardiomyopathy? A, increasing the dosage of clozapine. B, continuing clozapine with close monitoring. C, immediate discontinuation of the drug. Or D, switching to another antipsychotic. The answer is C, immediately discontinuation of the drug. Myocarditis or cardiomyopathy are both serious adverse effects associated with clozapine that can lead to fatal outcomes if left untreated. Therefore, the immediate discontinuation of the med is necessary to prevent further cardiac complications and mitigate the risk of adverse outcomes for the patient. Let's go over the ones that are incorrect. Option A is wrong. Increase in the dosage of clozapine. The dosage of clozapine would be inappropriate and potentially harmful in the context of myocarditis or cardiomyopathy. So definitely we don't want to give them more of the med. Option B, continuing the med and just monitor closely. No, can't do that in the presence of myocarditis or cardiomyopathy. And then option D, switch into another antipsychotic. That's incorrect as well, because by switching to another antipsychotic, it might not actually address the immediate cardiac concerns associated with clozapine-induced myocarditis or cardiomyopathy. Moreover, abruptly discontinuing the med without appropriate management could exacerbate the psychiatric symptoms and lead to further complications. All right, all done. I hope this helped and you learned a lot. Please share this with a classmate or a colleague. Go ahead and click on this video to take another test. Thanks. Have a good day.